Can you fix bad posture? Can you fix bad posture? That's the focus of today's episode of Ask Dr. Walter Salubro. What I do with these videos in this series is I take a question from the comment section under my videos on my YouTube channel, just like this one here today, and I'll answer that question in a video format, short video, maybe 3 to 6 minutes or so, give you some tips and advice based on the question. And then I upload that video onto my YouTube channel, and I'll do this each and every day as long as I keep getting engagement and interest. So today's question comes from Wolf77. Wolf77 has been a long-time follower of my channel, so thanks for engaging with my channel, Wolf77. And this is the question that Wolf77 asks. Hi, Dr. Walter. Thank you for your videos. My question is it possible to fix a bad posture? And what percentage? And how long? After decades of walking, sitting, and sleeping, etc. In my case, I'm 44 years old. So thanks for the question, Wolf77. You ask a very good question. And the short answer is yes, you can fix bad posture. We've done it over and over and over again in our office, and we see these changes on a weekly basis when we examine our patients, okay? So what we do is we take posture pictures of our patients. We use an app called Posture Screen Mobile, and we take a front profile and a side profile and measure the patient's starting posture. Okay, we know what normal should be like, and then we can see what the patient's posture looks like on a photograph. We draw lines of references, and we can also get measurements of translations and distances and tilts and so forth. Okay, then we apply corrective care techniques, chiropractic biophysics techniques, mirror image adjustments, and mirror image exercises to retrain the posture to go into a better position, try to get as close as possible to neutral. Now, we may not get it perfect every single time, but I can tell you consistently, we've seen some changes in our patient's posture. I've seen some change almost in every patient, improving their posture. There's complicating factors like scoliosis and kyphosis and other things like that can make things a bit more complex. But in many cases, we do see actual corrections of posture, some more dramatic than others. The nice thing about this Posture Screen Mobile is that we can do a before picture, and then in the follow-up a month later, we can do another picture, and then we keep following up with the patient as long as they're with us, okay? I'll actually post a link in the description below with a video that I did that shows how we take posture analyses with Posture Screen Mobile, okay? So it's hard to give you a percentage precisely of what kind of percent success we can get. I just know that's pretty consistent. Let's say at least 8 out of 10 people will show some degree of postural change and improvement, and it can vary from person to person. It can be anywhere from like 20 to 50%, okay? No one's gonna get 100% perfect posture every single time, but we do get improvement in people's posture, okay? How long does it take? That's a good question. So it's gonna vary on the complexity of the posture displacement. Complex things like scoliosis and thoracic kyphosis may not change dramatically immediately or at all because they're very complex, but we do see some changes in some scoliosis patients with advanced techniques like scoliosis bracing. But with our chiropractic biophysics technique of mirror image adjusting and mirror image exercises, we can see changes immediately in the first 4 weeks of care, and for sure in the first 12 weeks of care. So it's pretty quick that we can see these changes, okay? And how do we know? Is we measure before and after with that Posture Screen Mobile, okay? So it doesn't matter on the age. We've seen changes also in people that are older, way above the age of 44, and we've seen changes in people that are younger, teenagers and also kids, okay? So the key thing is to get your posture evaluated. If you haven't been under the care of a corrective care chiropractor, and this is for everyone, right, this information, this question just drives the content, right? But if you haven't been under the care of a corrective care chiropractor, you can look for one in your area. If you want a referral directory where you can find one, just comment below. Tell me, Dr. Walter, can you send me the referral directory? And I'll send you a link to a directory of chiropractic biophysics trained and certified chiropractors around Canada, the United States, and some other areas of the world as well. And you can get this evaluation done with them and see what kind of care you need, okay? So yes, we can make corrective changes of posture. It can be anywhere from the first few weeks to the first 12 weeks to see some changes. And it will vary from person to person, the amount of correction we get, but it's pretty consistent across the board in many patients. So that's the answer of today's episode. This is episode 22, by the way, 22. So if you're new to this, do subscribe because I do put these videos up each and every day. So there's daily content on my channel, plus there's a whole bunch of other content as well on disc bulges and sciatica and corrective care and scoliosis and posture in my video channel. And what I do with this series is I'll take a question from the comment section and then make some content to actually answer questions that you have in your mind. And when one person asks a question, I bet you another 10 or 12 people had the same question, okay? So do subscribe so you get this content coming to your feed every day. As well, comment below. So do subscribe so you don't miss out on these daily video updates. Do hit the like button so it helps with the YouTube algorithm. And as well, leave a comment or a question. And who knows, maybe your question will be featured next in the Ask Dr. Walter video series. And if you missed some of the other episodes, just go right here at the playlist right there to catch some of the past videos. You can binge watch all of them. You can pick and choose some of your favorites. Either way, you'll see the playlist right over there.